I went so hot all over, and I got back in the bed, but I couldn't bear it.
Marina has just suffered a heart attack. It's her third in just 2 years.
I was surprised the ambulance came within 2 hours, so I thought that was very good. And I was in here before 8 o'clock this morning.
It took 2 hours for the ambulance to get to you.
Well, they did say they had a priority list and I was on it. You've got to think there's lots of people calling ambulance.
Marina is 90 and lives alone. She knows this hospital well. Last year, they found she has an untreatable tumour. You must be very worried.
Well, I'm 90 years old and the time, you can't go on forever. And I've had my life, and the best thing is to keep calm and carry on.
She's just one of the patients whose life was saved by the team at the Royal Berkshire Hospital. Over 2 months, Sky News has been given rare access as staff battled one of their most difficult winters yet.
Oh, beauty room flanking. Yes.
And we don't have a clue when she took it.
Omar Nafusi is the clinical lead at the Royal Berkshire Hospital A&E, one of the busiest in the southeast of England. It's the first week of December, and the worst of winter is looming. 191 patients today. It's 1 o'clock in the afternoon on a Wednesday. Is that typical? That seems quite high for a midweek afternoon.
Yeah, it's the new norm. We see probably about 480 to 500 patients a day on busy days. Sometimes over 500, those are really busy days. But that's becoming more and more frequent. Our attendances are going up and up and up year on year. And we are struggling. We are trying to cope as best we can and give patients the best care we can. But it's not always possible. That's the sad truth.
In 2010, NHS England set a standard of 95% of patients waiting for no more than 4 hours to be admitted, transferred or discharged. That target hasn't been met in a decade. So this one, that's 14 patients waiting for 941 minutes for a bed.
Yeah.
That's too long.
That is too long. Without a doubt, that's too long. And that's not what anyone wants. No one in this trust wants that to happen.
These waits of 15 hours and more are replicated across the country. And the figures are even more alarming when compared to total number of waits over 4 hours before the pandemic. With so many patients waiting so long, finding those in need of urgent treatment is like looking for a needle in a haystack.
There's a lot of anxiety after COVID. Young people with chest pain, which they've had for a few minutes, are concerned they had an heart attack. There's a lot of little things that before would have been nothing, but now is something.
An increase in young, anxious patients is combined with an ageing and medically complex community whose needs are increasingly time-consuming.
As other services sort of fall apart or are perceived to be more difficult to access, more people end up here because it's just the easy option. If you turn up, you'll be seen.
Because your doors are always open,
Yeah.
You never turn anyone away.
Not at the moment. We may get to the stage when actually we're just looking at people and saying this isn't an emergency.
Really?
Yeah.
You really think it'll go as far as that?
I think so, yeah.
And how long has she been suffering with this for?
Okay, so I checked your notes. I need to book you in for a routine appointment with Dr. Pearce.
More than 1 million people who attempted to reach their GP in December couldn't get through.
All right, I'll get that done.
That's despite there being more appointments than ever before. Mental health anxiety. Dr. Amit Sharma runs 4 surgeries near the hospital.
So what you can see here is the level of appointments have changed significantly. So November 2018, you can see it was about 27, 28 million. You can see last month it's peaking almost at 40 million.
What's driving it?
That's got to be around anxiety. That's what we see every day.
The government wants to move care away from hospitals into the community to improve technology and to put more of a focus on preventative medicine. But mental health targets are among those to have been cut.
When you're going through periods of anxiety, it often leads to physical symptoms. And often people are having chest pains or palpitations or breathing problems or other issues, and actually may not be able to realise that this is a mental health related condition, and because you're feeling physical symptoms. There's no doubt that fear and fear around health is rising as a nation.
We start with breaking news, and in the last few minutes, NHS says it's being hit by a tidal wave of flu hitting hospitals.
It's mid-December and the so-called quademic of COVID, RSV, norovirus and particularly flu are climbing steeply across the country. Simon is among those affected. He's been in hospital for 5 days after being rushed in by ambulance.
I've suffered with asthma all my life from the age of 2, and I had diagnosed with COPD 5 years ago. But obviously, there's so much of it out there, so much flu germs out there, and you don't think about it until it happens to yourself. Well, you come in here.
Good morning, Mr. Shuri. Hello, hi, Dr. Thomas here. How are you?
He's an example of how medically complex patients can now be. On top of his chronic, lifelong breathing difficulties, just 6 months ago, he was put into an induced coma after suffering from sepsis after a kidney infection.
And you walking out at all? Or?
He says he's waited up to 2 days for a ward bed on previous visits.
Every time you come in, it's getting worse for them. It seems to be so much pressure on them, you know.
Simon is being kept in a side room to contain his infection.
We're seeing rapidly rising numbers. Obviously for us that impacts on both the numbers of people coming into hospital, our flow, because obviously these patients have to be cohorted together and it's more difficult to manage them in the general hospital setting. And there's impact on staff as well, because obviously our staff sickness rises as well.
Like all hospitals across the country, finding space on a respiratory ward like this one is extremely rare. As soon as a patient is fit to be discharged and a bed becomes empty, well, there's a queue of patients waiting to take it. A lack of spare beds leads to longer ambulance handovers. A total of over 600,000 hours have been lost to ambulance handover delays so far this winter. That's equivalent to around £31 million spent by the NHS, while ambulances are not available to make new pickups. In the first week of January, 24 hospitals declared critical incidents following a surge in flu cases. And while the Royal Berkshire Hospital wasn't among them, they did take the decision to temporarily not allow us entry to film. We were supposed to be inside today filming in your respiratory wards. We can't because it's just so busy. What's going on inside?
So our ward occupancy at the moment is running around 99% of our beds. So we are absolutely full. Our respiratory unit, half of it has been given over for patients with flu, and we've got a lot of very kind of unwell patients in the hospital at the moment. And each morning over the last few days, we've actually been starting the day with around another 20 to 30 patients actually in the emergency department waiting for beds. So the bed pressures have been really significant.
A day later, we caught up with Omar in the emergency department.
Busy, really, really busy. Every year we say it gets a little worse. This year has felt worse than any other year that I remember. I've been consultant for 15 years in emergency medicine, and this is by far the worst year so far. Since I last saw you, it's just the pure number of sick people that need to be admitted has just risen exponentially.
How does that impact patient safety? You can't have patients here long term, can you?
No, we can't, no. I mean, we've only got 20 major cubicles, so you can imagine 25 waiting for a bed, some are on chairs, some are in the waiting room, but we have no space to bring patients in off an ambulance to see and examine them.
Almost every single bay is full. There's just one free at the moment. There are patients waiting to be transferred to the wards, and while we've been here in the last couple of minutes, 2 more patients have been brought in by ambulance. Things in ED change very, very quickly. A major issue is capacity. Royal Berkshire Hospital opened in 1839, and parts of that original building are still used to this day. Others have fallen into ruin. hospital leaders had hoped already approved plans for a new hospital would answer their growing list of problems. Now, the Health Secretary says that work can't start until 2037 at the earliest, blaming the previous government for over-promising and under-delivering.
There were never 40 new schemes, and many of them were extensions or refurbishments. Put simply, they weren't all new, some of them weren't hospitals, and there weren't 40 of them.
This listed building behind me is crumbling, and it's been out of use for more than a decade. The hospital has already spent £2.5 million just making sure it doesn't collapse. It would cost £15 million to make it usable. The trust is considering filling it with concrete to make it safer. A hospital running out of space and short of money currently has no alternative but to waste both. Another area where health leaders are concerned about wasted resources is in the number of patients fit for discharge but waiting for packages of care or transfers. People like Colin. He's been at the Royal Berkshire for 10 days after a car ran him over and left him with a dislocated ankle and a fractured leg. Do you know why you're being moved to a community hospital? Did they explain why?
Well, to get the physiotherapy. I mean, all I was doing on the general ward up there was being fed, really, and they weren't providing much in the way of physiotherapy, you know.
But it also helps to free up your bed in an acute hospital.
Absolutely, yeah. But there seems to be a dire shortage of beds in these sort of community hospitals.
In January alone, 500 patients came through this discharge lounge, the most on record. Nationally, at its peak this winter, nearly 14,000 hospital beds were filled with patients who were waiting to be discharged. Colin faces a long period of rehabilitation, and he's concerned about what this means for his family.
I'm the sort of full-time carer for my wife at home, and my daughter's looking after her at the moment. And that our house isn't suitable for, it would have to be markedly adapted, to take me. So, I'm not absolutely sure what's going to happen.
You worried?
Yes, yeah. Yeah, I'm worried about my wife.
The government is expected to announce a new 10-year health plan in the spring. The NHS faces a backlog of 7.5 million routine operations and procedures. But there is also an urgent need to tackle the immediate high demands and crumbling infrastructure felt throughout hospitals like the Royal Berkshire, so that patients like Marina can get the dignified treatment they deserve.